the WJCT News Team.
Good morning, I'm Ann Schindler, and this is First Coast Connect. Today, the veepstakes is over. We begin with some political analysis after the vice president announces her vice presidential pick. Then, an overhaul of the state's Baker Act gives police more discretion in managing suspects with mental illness. We talk to a clinician and the Jacksonville Sheriff's Office about what to expect as the new law takes effect. And a local candidate is vying to become the youngest member ever of the Florida House. A conversation with Benjamin Sandlin. Join the conversation. Give us a call at 904-549-2937 or email firstcoastconnect@wjct.org. It's all ahead this hour after the day's news.
Live from NPR News in Washington, I'm Corfa Coleman. Vice President Harris and her new running mate, Minnesota Governor Tim Walz, will campaign today in Michigan and Wisconsin. They were welcomed at their first rally last night in Philadelphia by Pennsylvania Governor Josh Shapiro. From member station WHYY, Carmen Russell-Sluchansky reports Shapiro was considered for the ticket.
If Shapiro was disappointed to have been first runner-up in the competitive veepstakes race, he didn't show it.
I love being your governor. Thank you very much. Y'all fill my heart.
Shapiro heaped praise on Harris's VP pick, calling him a great man.
Tim Walz is an outstanding governor. Tim Walz is a teacher. Tim Walz is a guardsman. Tim Walz is a great patriot.
Walz returned the tribute, calling Shapiro a treasure. For NPR News, I'm Carmen Russell-Sluchansky in Philadelphia.
Former President Donald Trump expressed surprise to Fox News at the choice of Walz for the Democratic ticket.
He's a very liberal man, and he's a shocking pick, and I'm thrilled. I could not be more thrilled.
Republicans are criticizing Walz over his response to Minneapolis protests in 2020. These came after a white police officer murdered George Floyd. Prosecutors in Milwaukee, Wisconsin, are charging 4 hotel employees with murder in the death of Devontae Mitchell. Video showed them holding down Mitchell, a black man, and beating him. Mitchell's widow, Decia Harmon, says police should have arrested the suspects immediately.
When the police came, they were still on top of him. When the police flipped him over, he was gone. They should have charged those people right then and there.
The incident happened June 30th. Research released today shows that the number of abortions in the U.S. has continued to go up even after the Supreme Court overturned Roe v. Wade. NPR's Alyssa Nadwarny reports the increase is driven by the rise of telehealth abortions, where patients receive medications in the mail after consulting with a clinician.
The monthly average of abortions nationwide was nearly 100,000 in the first 3 months of 2024, according to data from the Society of Family Planning's We Count project. That's despite the fact that in-person abortions have plummeted in the 14 states that banned the procedure.
The rise that we're seeing in abortions is not an increase in demand for abortions. I think that it is a lot of the unmet need that was previously unaddressed.
Ushma Upadhyay is a public health scientist at the University of California, San Francisco, who co-led the research. Telehealth abortions now make up to 20% of all abortions. Research shows they are as safe and effective as in-clinic care. Alyssa Nadwarny, NPR News.
You're listening to NPR News from Washington.
This is WJCT News 89.9 in Jacksonville. Good morning. I'm Michelle Coram. In-person early voting starts today in Duval and Nassau counties. It starts tomorrow in Clay and Baker and on Saturday in St. Johns. It already started Monday in Putnam County. If you plan to vote by mail in the primary, the state deadline to request a mail ballot is tomorrow. St. Johns County might ditch its new trash company after more than 2,000 residents didn't get their trash picked up during the company's first 2 days on the job. The county commission voted earlier yesterday to give the company 7 days to clean up its act before the county begins to look for a new contractor. County Commissioner Sarah Arnold says when a hurricane was approaching Florida, doing such a bad job is unforgivable.
This was without question a catastrophic failure in rollout. Not to mention it was a catastrophic failure when we were staring down the eye of an impending hurricane. That's just where I can't get past it.
To pick up the slack left by FCC Environmental Services, St. Johns County mobilized its own staff to pick up trash Monday morning. FCC Environmental was also recently approved as Clay County's garbage collector, with service set to begin October 1st. The city of Jacksonville's credit rating has increased with one of 3 leading rating agencies. Mayor Donna Deegan explains that this means savings for taxpayers through lower interest costs and money back into the city coffers that can be spent on services. Partly sunny and windy for this afternoon, 30% chance of thunderstorms anytime after noon today.
Support for NPR comes from NPR stations. Other contributors include C3 AI. C3 Generative AI works to enable rapid access to traceable, hallucination-free insights from enterprise systems, helping turn the invisible into the obvious. This is Enterprise AI.
Support for First Coast Connect is provided in part by Baptist Health and North Florida TPO.
Good morning. I'm Ann Schindler, and this is First Coast Connect. Today, Kamala Harris turns to the heartland for her running mate. We examine the political calculations behind her choice. Then, in just a bit, changes to state law regarding involuntary mental health commitments. We explore what it means for police, providers, and patients. But first, the Veep stakes ended yesterday. Minnesota Governor Tim Walz joining the Democratic ticket. Here to help us analyze the choice is political consultant John Daigle. Good morning, John.
Good morning, Ann.
So tell us what is at stake here. What is Kamala Harris's political calculation? Why did Walz get the nod?
Well, it's really interesting, and I thought it was a brilliant choice. I've worked with many candidates over the last 25 years, and one of the hardest things that any new politician or new elected official has to learn is that almost every decision you make makes some people happy and others unhappy. I think in this situation, you had, after Harris took over from Biden, you really had a lot of people on the Democratic side worried about the fact that we had obviously picked up, the party had picked up progressives and minorities and youth, but it wasn't at the sacrifice of blue collar and labor and unions. And I think the Walz pick was a brilliant choice because he's a progressive and he's liked by progressives, but he's also going to be very effective with those blue wall states, Wisconsin, Michigan, Pennsylvania, with union and labor in those states. He's very friendly with those groups. So I think in that respect, whereas on the Republican side, the J.D. Vance pick did not really appeal to a different group other than the ones that Trump already had. On the Democratic side, you have a vice president pick that really does balance the ticket and helps her attract some voters that party may have lost when they switched from Biden to Harris.
I want to ask you about tone as well, because Kamala Harris has projected a somewhat joyful warrior position, I think is how she likes to see herself. Tim Walz was the creator of this kind of weird description of the Republican Party that has caught on as a mocking but not angry tone for the Democrats in terms of taking on Donald Trump and J.D. Vance.
Yeah, and then from a messaging standpoint, it is actually been very effective. And as you said, we saw how quickly that messaging line of normal versus weird has taken off. The Republicans have tried to switch that and play it, but it's not really landed very effectively. It's certainly not as effective as it has been working for the last week or two on the Democratic side. It's a messaging that is, much more easy for the normal person to understand versus, memes or labels like fascists or stuff like that. And that's why it's powerful in its simplicity. And I think that is very much what Walz is going to bring to that ticket, which is the ability to speak to the common man, the blue collar worker, average people in their language, which is what he has seemed to have done very well in winning some seats that were not, hard Democratic seats. He's been able to speak to Republicans and Democrats. And the other big thing he does, which Vance doesn't seem to do, is go after those independents, which is a huge block of voters in this race who probably will decide this election. And I think the one thing he brings to that ticket, which is an appeal to independents who are turned off by most of today's politics, but will appeal to enjoy his common sense, no nonsense working man kind of style on the campaign.
What about some vulnerabilities that he may have? What are the things that Republicans are going to attempt to attack him on?
Yeah, well, you can watch right now that they're trying to throw a few things at him, see what sticks. And it's probably going to take a while for them to figure out exactly what is the strongest attack. They're certainly going to attack him on what is perceived as a slow response to the riots following George Floyd's murder in Minnesota. There's been some scandals that he's taken responsibility for. There was a multi-million-dollar scandal in terms of after the COVID with some organizations in Minnesota that got relief money and turned out to use it fraudulently, which he took responsibility for. Those things probably won't be, the ultimate attack. For the Trump Vance team, they're going to have to come back to trying to paint him in some way, which will be very hard, but try to paint him as a leftist, radical, liberal. Those are the labels that will probably be most effective, but it's going to be difficult with him having born and raised in rural Nebraska and his style in general. It's going to be hard to paint him as a radical liberal.
Right. And he's talked about his evolution on something like guns, where he used to be A+ with the NRA, and now he's a steady F.
Yeah, I mean, he's got a voting record. He's got stuff he can talk about with moderates and with Republicans, and he's also got a really strong voting record that will appeal to progressives on stuff like abortion rights, gun control, support for children, and meals programs. He can really talk to almost any audience in a way that almost anybody, Trump or Harris, can't do.
Well, it's an interesting race. It's getting more interesting all the time. And we will, of course, be talking to you in the weeks and months ahead, John Daigle, about this very thing, including on primary night on August 20th.
Yeah, looking forward to that.
All right. Same here, John. Long-awaited reforms are changing the rules surrounding involuntary detention of people with mental health and substance abuse issues. To discuss the new law and the changing conversation around mental health and law enforcement, we're joined by Officer Chris Russo with JSO's Behavioral Crisis Response Unit. Welcome, officer.
Thanks for having me.
Jacksonville Sheriff's Lieutenant Robert Lestrange Jr., who oversees the unit. Good morning, Lieutenant.
Good morning.
And Dr. Christina Cauffield at LSF Health Systems, which coordinates behavioral health care for the state in 23 North Florida counties. Welcome back, Dr. Cauffield.
Thank you. My pleasure.
So I'm going to start with you, Doctor. These laws impact the so-called Baker Act and Marchman Act laws. Those are 50-year-old laws in the state. Remind us what they each do.
Well, they were originally brought forward in 1970 to ensure that individuals that needed help, that were at risk of harming themselves or others, would be able to be involuntarily admitted to a crisis stabilization unit. And as time has passed, we're finding that reform was necessary. Representative Maney out of the Panhandle really was the champion of this bill, and he took several years to push it through, but very grateful that it's come to fruition this past legislative session, and there's some really good things in this bill that were needed.
Why was reform needed?
Well, we're finding that children, particularly here in Florida, were some of the highest in the nation for receiving Baker Acts. And so people were very disturbed about this. Parents, loved ones felt like they were out of the loop. So there's some language in this bill that addresses that. There are lots of concern around just how many people are Baker Acted that really do need it. And is there another way to put them in a less restrictive environment?
These detentions are initiated by family or loved ones. Is that correct?
Family, loved ones, law enforcement, school personnel. So referrals come from a variety of sources.
And Lieutenant Lestrange, one change in this is it gives law enforcement some more discretion that it has not had in the past. And tell me if my reading of this is correct, but the former law basically mandated that if an officer was summoned to a Baker Act type circumstance, that somebody wanted to Baker Act a person, that they were required to basically take that person into custody. That person would then be held generally for 72 hours, 3 days.
Correct. And what the new legislation helps us with is the officer's discretion. Instead of perhaps making it mandatory, as you said, for us to Baker Act someone, now we have a little more discretion. We consider what we would call voluntary examinations, or we can, especially as a unit, help people get services. And it gives us a lot more latitude to kind of just, especially our unit, to talk with people, figure out maybe that they might be having a bad day, but they don't necessarily need to be Baker acted. Whereas in the past, officers were afraid that if citizens said certain things to them, they would automatically be Baker acted. So now we have a chance to really kind of help people with services they might need, whether that be through MHRC, child guidance, any kind of service that might help them with their mental state at the time and in the future. So that's where it helps law enforcement. We're not required now. It gives us the authority to Baker Act somebody.
And as Dr. Cauffield alluded to, I would imagine that that's a very difficult process and decision to make when it's a child that's involved. If you're being called to a scene and feeling required by law to take that child into custody.
Whenever we're dealing with children, it's such a delicate situation, and getting a child the best help, the best care, and not perhaps putting them in the back of a police car and giving them that experience certainly could be traumatic for them. So opening kind of the laws, opening to giving parents and children a different direction when it comes to children who might be experiencing some kind of mental illness is certainly favorable for everybody.
Yeah. Officer Russo, you work with JSO's Behavioral Crisis Response Unit. Why did you want to join that unit? And tell us a little bit what your day-to-day job is like.
So the unit started back in 2019, and I was kind of one of the first officers to jump in on it. There was a leader that had an idea, and we kind of put our ideas together, and MHRC had presented this program to us.
That's the Mental Health Resource Center?
Yes, the Mental Health Resource Center had presented this program to us as a pilot program. So we jumped into it full speed just because we knew that there was a need to provide these services to the people in need in the community, and that's one of the main reasons why I jumped into it, was to try to avoid individuals being Baker acted or arrested when they could use other services long term versus just a short term fix kind of thing. And yeah, that's the main reason as to why I jumped into it. And a day-to-day operation for us is we have our mental health professionals that are with us. We kind of screen our calls for service to determine which ones we would prove to be most beneficial on. When we arrive on scene, we make sure that the scene is safe before we bring our mental health professionals up. And then we kind of just start asking questions, which I've found to be huge when it comes to providing the services, because we don't know what services to provide unless we know what they need. So we'll ask those questions, to kind of navigate down that path, and the mental health professionals will kind of jump in and start, figuring out what resources are best for them, and then we'll go that route.
And does that approach help divert some people that might otherwise have been taken into police custody?
Yes, absolutely. So we determine, as well as, what's going on with them in that moment. And is this something that they need an emergency room right away for, or is this something that we can kind of guide them more towards an intensive outpatient kind of treatment, or even so much as just making a phone call to their doctor at their doctor's office and seeing if, they can't get in a little bit sooner to see their doctor, to try to avoid dropping them off at, an emergency room if it may not necessarily be in an emergency situation that requires that.
If you're just joining us, we are talking about local mental health changes that are coming as a result of new state laws. We're talking to a mental health clinician and the Jacksonville Sheriff's Office, and you are welcome to join the conversation. You can reach us on air at 904-549-2937. You can email firstcoastconnect@wjct.org, or you can reach out on social media. Lieutenant, I want to ask you in terms of screening calls, as the officer mentioned, there are 911 calls, and we know that there are also 988 calls that are coming through. Those are primarily for people who are contemplating suicide or having a mental health crisis of that nature. How do you determine when you're going to send the crisis unit and when you're going to send just an officer on duty?
Well, that's something that the officers in the field kind of they kind of look at their screens, they listen to the calls that are going out, and they kind of decide, hey, this sounds like something where we could be of great assistance. Or the dispatchers, a call could come right from 988, and the dispatchers can directly connect with the officers and the clinicians right there. So it's kind of a two-pronged attack, so to speak. It gives the officers a little latitude, like they've got a whole district, a whole area to look at. So they have to monitor that. And not every call that comes into 911 might seem like a call that involves mental illness until, officers get there and start asking some questions. Then our team can respond with those officers. Or conversely, a call might come right away from 911 or 988. Somebody's in crisis, somebody's in distress, there's a history of it. Our officers can respond right away to that also.
So it's not necessarily a dispatcher that's making that decision. It more is the unit monitoring these calls.
It can be, yes.
Yeah. Okay. Um, Dr. Cauffield, the work that you do in the community is, related obviously to what JSO does. In fact, I believe some of their funding comes from LSF.
Correct.
For this
Yes.
particular. So what are the expectations that the mental health community has of the officers that are now doing this kind of intervention, and how do you believe they're performing?
Well, I can tell you that their results are extraordinary. The diversion rate for the individuals that they respond to is around 92%. So 92% of people that call expecting or thinking that they might end up in a CSU or jail are diverted to other services. That is a tremendous savings to the community, as well as obviously the right thing to do for the client. So we couldn't be prouder of this program. Our clinicians are so grateful to be able to work with the officers, have them there for safety as well as conversation, able to really triage a situation with their lens as well as the clinical lens.
And is this unit 24/7 available now, Officer Russo? I know that there was a time when, it wasn't available on weekends. There were some incidents that happened over weekends where the unit was not working. What is the cycle now of when they're available to respond to calls?
So right now we're available Monday through Friday from 0700 in the morning to 1500 in the afternoon, 3 p.m. And when we're not available, officers will still, handle the call as they need to, but they'll write reports, and those reports get routed to us. So whenever we come back into work, we do follow-ups on those reports. So the individual may have been, placed into a CSU on a weekend.
And that's a crisis
stabilization unit.
Is that the same as a Baker Act receiving unit?
Yes, ma'am, an involuntary commitment. So they may have already been placed over the weekend. So when we come back in the following week, we will do a follow-up with that individual just to continue, try to provide those services. And in that aspect, we try to do it, preventative to prevent it from happening again.
Lieutenant Lestrange, are there numbers that you are tracking in terms of diversions like the doctor mentioned, or just overall calls that the unit has handled?
Yes, ma'am. Every month we track the number of calls that we handle, the number of follow-ups that the officers do, our diversion rates. And like the doctor was saying, across the board, the numbers are just phenomenal. And they would be even better. We don't work on weekends and nights right now, but there is a need for that. And we're always talking about expansion. But the numbers themselves, if you look at the data, it proves just how worthwhile this program is and how much help it gives to the citizens and the police officers.
I mean, I would almost think that the need is greater around those times,
Yeah.
weekends, nights. Those are times when people may be using substances
Yes, ma'am.
or encountering crises with a loved one that they wouldn't during a regular work week.
So part of what our officers in our unit does is educate our other officers who are working nights and weekends, so that they might be able to better handle those situations. And you can't prevent every Baker Act, but you certainly can offer people services, and we can follow up and, like Chris was saying, prevent it from happening again.
What is the expectation of officers now to be trained to some degree in responding to a mental health crisis situation? And is there any resistance to that obligation or this marrying of officer duty to a mental health component?
All I've heard from officers and supervisors and our leadership is that it's a great program. It helps the officers, it helps them understand how to speak with citizens better. It helps them understand the whole process. And it gets them out of a loop where they feel like they always have to take somebody to a CSU. And it's very helpful to them. We're always educating, though. We always have new officers, and it takes a while for a police officer to learn how to kind of use their verbal skills with people who are exhibiting mental illness.
Is there any discussion about having these units accompany patrol officers who I would imagine are encountering people, on the street? I'm thinking particularly of downtown. If there are situations that a patrol officer and a mental health counselor accompanying them would be proactively able to intercept some problems.
Yes, absolutely. Like I said, we welcome growth of the unit. Right now, Chris and his partner, they work downtown, so there's only two of them and one clinician. But certainly, if we had the resources, we could have 4 officers, 2 clinicians. It takes those teams